Firstly, you need to look at your weight to control your weight. If your BMI, body mass index, is higher than recommended, for example, like overweight, in our race, like Asian population, the BMI of more than 23 is considered overweight. So if we are overweight, we should lose our weight. If you are already obese, be more hurry to get your weight down. You can sleep on your side to help too, because sleeping on the side can make the diameter of the upper airway a little wider compared to sleep on your back. And they should avoid drinking alcoholic beverages, since the alcohol, it can reduce the tone of the muscle and cause snoring sound louder. You can observe if people get drunk, they will snore louder than usual, right? And they should sleep. We recommend sleeping 7 to 9 hours a day. So if you suffer from a poor sleep quality disease like OSA, so you should kind of make sure that the duration of your sleep is adequate. And finally, maybe avoid drinking coffee in the afternoon, since caffeine can cause you awakening more during sleep. Some people can argue that they might fall asleep easily even though they drink coffee, but actually coffee have kind of the effect to your brain and cause you awaken more frequently during the night, and can make sleep apnea worse as well. Okay, I see. So they should get the sleep test done first to see whether they have sleep apnea or not. And the test can provide so many informations in detail to, for example, how many times that they stop breathing or they breathe inadequately during sleep. And it will kind of tell how severe. It can measure the oxygen level in your blood during sleep. If your oxygen drop down, the disease may be more severe. And also we can look at the sleep stages by looking at your brain waves to see how much deep sleep that you get, how much REM sleep that you get. Do you have abnormal movement during sleep as well? Something like that. And after you get the sleep test done, so we can diagnose you with sleep apnea with a very high sensitivity and specificity. I mean, like, it's a gold standard, so we can make sure that you will get your disease diagnosed with the sleep test. We can also provide home sleep apnea test in some particular people who have severe symptoms and probably are at high risk of having OSA. We can provide that too, but it needs to be clarified by a sleep doctor first, so it's not suitable for everyone. After getting diagnosis, for the treatment standpoint, the most effective treatment of choice is the CPAP machine. It's short from continuous positive airway pressure therapy. Basically, it's an elliptical device that contains a blower. They can create pressurized air by, like a fan, blow the air, and the air is pressurized and will be given to the patient via the tube and the mask. And people will use this mask during sleep, and the pressurized air will be a splint to keep their airway open during sleep. And when the airway is kept open, they will not suffer from stop breathing. They can breathe easily with a patent airway, and the oxygen level will not drop down, and finally their quality of sleep will be restored. For other options, in some people who cannot tolerate the machine, because it's quite needs some patience, needs some acclimation to use the CPAP machine. So some people cannot tolerate that, and we can also provide another treatment option. For example, mandibular advancement device. It is done by a specialized dentist. It is a device look similar to a retainer in patient who have dental brace. So put inside the mouth, and it can kind of advance the jaw forward a little bit. In people who have milder sleep apnea, or maybe moderate one, or even severe one who cannot tolerate the CPAP, we can use this device. And lastly, the surgery one. In the past, the surgery was quite popular because, like the structure that commonly produces the sound snoring is uvula. So they cut out the uvula, the one that flutter. So the snoring sounds can be quieter, but they found out that because the obesity is a major cause, so the level of obstruction is not solely at the uvula level, sometimes deeper down than that. We get rid of the uvula but still have some obstruction down below, so it's not as effective as the CPAP. So we can choose the suitable candidates, the ones who have milder degree of sleep apnea, and if they have long uvular and tonsillar hypertrophy, means that a large tonsil glands inside, we can send them to the ENT doctor to consider the upper airway surgery, or even more aggressive surgery, but it is done in a very few centers. I'm not sure that in Cambodia they have it yet, but in Thailand there is only a few centers that can do we call it MMA, maxillomandibular advancement surgery. This one is more aggressive. Yeah. Okay, so please stay healthy and control your weight, not to be overweight, not to be obese. Maybe by exercising regularly, and if you have the problem about the nose, maybe allergy, chronic rhinitis from any cause, you should treat it effectively, because if you have a nose obstruction, it can affect how you breathe during sleep as well. And you should avoid drinking alcoholic beverages before bedtime, since, like I said, it can lax your upper airway during sleep, and it's not good for your sleep. Actually, it can make you feel sleepy quickly, but during the night it will cause you waking up too early, and you will end up having lack of sleep on that night. And in general, for sleep hygiene, you should sleep adult like 7 to 9 hours per day, but in adolescents who are in the teenagers, maybe 8 to 10 hours a day. Maybe that's all.